Welcome to Health Diary. My name is Winnie Lubembe and we're coming to you from 4 Point by Sheraton right here in Hurlingham. Now, of all the different types of arthritis, osteoarthritis appears to be the most commonest. So what exactly is it about osteoarthritis? Who is more at risk of developing osteoarthritis? And what are some of the treatment options? Well, we find out after this fact of the matter. Osteoarthritis is a long-term chronic disease characterized by the deterioration of cartilage in joints, resulting in bones rubbing together and creating stiffness, pain, and impaired movement. The disease most commonly affects the joints in the knees, hands, feet, and spine, but is relatively common in shoulder and hip joints. While osteoarthritis is related to aging, it is also associated with a variety of risk factors, including obesity, lack of exercise, genetic predisposition, bone density, occupational injury, trauma, and gender.
Mom ndio yuko na shida ya osteoarthritis na ilianza kitambo kitu wa mwaka 2007 ndio dalili zilianza kuonekana. Lakini wakati tulipoenda kutafuta matibabu walituambia ni uzito yake ilikuwa kubwa sana kwa mwili. Sasa ikakuwa apunguze uzito ndio mguu atasikia mzuri. 2010 ndio tena ile shida ikarudi. Na ikarudi kwa sasa ikakuwa sasa mguu imefura, mgongo pia imeanza kuleta shida. Sasa ndio tulienda kwa hospitali kadhaa. Tukaenda Kenyatta tukaona na madaktari wa huko wa mfupa. Na sasa ndio mara ya kwanza ndio alipigwa picha sasa mzuri zile za kuoneshana kweli hiyo arthritis iko. Hatukusaidika sana juu bei yake ya kufanywa upasuaji kwa Kenyatta ilikuwa iko juu sana. Akaandikiwa madawa ya kumeza ya uchungu, tukafanya mpaka zinaitwa harambee. NHIF ilisaidia juu ile pesa tulikuwa tumechangisha, ile ya physio ilibaki ikiwa mingi juu. Sasa ile NHIF ilikuwa imecover at least half. Tulipatana na daktari mzuri sana, akamfanya upasuaji ya kwanza kwa goti yake hii moja upande ya kulia. Kwa bahati mzuri ule mzee bado alikuja akatuambia ule daktari hiyo pesa anaona ataweza kufanya hiyo hip replacement, na akafanya. Na sasa unajua bado tukikaa akai hivyo, ni ule physiotherapist bado lazima akuwe yuko involved. Sasa anashughulikia goti na hip. Ikakuja pole pole hivyo mpaka wakati sasa ilipofika daktari akasema sasa yuko tayari kufanya upasuaji tena hii goti nyingine ya kushoto. Sasa yuko kwa hiyo upasuaji ya 3 ya goti na ndio bado anaendelea kusikia nafuu. Na bado sasa ndio anaendelea bado kufanya hiyo physiotherapy. Sasa hata bado safari haijaisha juu bado upasuaji nyingine imemgoja ya hip ya hii pande ya kushoto. Tunaona kuna improvement kubwa sana.
Now let's get to understand more about osteoarthritis, and of course to help us with the conversation we have Dr. Michael Maru, who's a consultant trauma and orthopedic surgeon at Nairobi Spine and Orthopedic Center. Thank you very much, Dr. for coming by today. And we also have Eliud Karanja, who has struggled with osteoarthritis since 1970. How is he now? Of course, we'll get to understand more on the same, and of course he is here with us today. But Dr. can we just start with you? Osteoarthritis, because most of the time we usually hear arthritis, right? So osteoarthritis, what exactly is it?
We need to talk about what is arthritis first before we get to talk about osteo.
Mm-hmm.
Yes, arthritis is a condition where the lining of the joint wears off resulting in bone making contact with other bone. The human joint is made in a way that the bone is not supposed to touch the other bone. The lining of that joint is called the articular cartilage. The cartilage wears off with age or sometimes with trauma or injuries, resulting in bone touching bone, and that is what we call arthritis. Okay. When you move on now to types of arthritis, the commonest type is osteoarthritis. Okay. Osteoarthritis comes with age, the gentleman sitting next to us here, where if you get an injury into a joint, with time, the joint will change, and that process of turning to arthritis is called osteoarthritis. The second type of arthritis is one that is called rheumatoid arthritis. That one comes in because of inflammation inside the synovium. Rheumatoid arthritis is an inherited condition. To put it simply, it's like your police cells fighting the same police cells in your body, so it's an autoimmune disease. The other type of arthritis is septic arthritis. Septic arthritis is where infection or bacteria gets inside the joint, destroys the joint, resulting in arthritis. The other type of arthritis, which is also common, especially in men, is gout arthritis. Gout arthritis is where uric acid is deposited inside the joint, destroys the joint, resulting in arthritis.
Okay.
Yes.
All right, and of course, we'll look deeper into then osteoarthritis, which is what we're focusing on today. But before that, let's talk to Mzee Eliud. And Mzee, ulituambia ilianza 1970. Ugonjwa ya mguu. Ni nini ilifanyika? Ulikuwa unasikia uchungu kwa mguu ama vile ulienda hospitali? Nini ilisababisha ugonjwa ya mguu?
Ulisababishwa na hii kupigwa. Sababu ilianza kuuma kidogo kidogo, halafu ikaendelea mpaka nikaona mguu inaanza kwenda kombo. Ikaendelea namna hiyo mpaka wa leo.
So then to what extent in terms of the severity of trauma does it mean that every time you get a trauma, especially on your joints, you end up with osteoarthritis?
Not necessarily. The injury that will result in arthritis is injury inside a joint. And I must say this in a modern context about motorbike injuries. Because of a motorbike rider, the knee is one that impacts the ground. So they get an injury inside the knee. Within 5 years, the knee has gotten osteoarthritis.
But again, and especially in a case of trauma, so then how do you know? Are there like specific symptoms to watch out for?
No, and I must say some people do get injury into the knee, but they don't get arthritis. Sure. The work of the orthopedic surgeon is to assess that joint. But I must say there's nothing you can do to stop that process going on. Yes, you can fix the bone, put it back together, but if there's damage to the articular cartilage, that usually results in arthritis because articular cartilage does not regenerate.
So Mzee Eliud, vile ulienda hospitalini, daktari, unasema ulienda hospitali, daktari hawakukuambia ni nini na kuumiza?
Daktari ile mimi nakwenda na hawa, wanasema wakate misisi. Alafu wanyoroshe iwe namna hii.
Okay. Ukakubali?
Sasa mimi nitapaa viatu namna gani? Nitakwenda show namna gani? Hata kulala nitalala namna gani? Kama iko namna hii. Wengine wanasema ati niende nyumbani, niwekeo kamba, ati niwe nikishika kamba, halafu naamuka kwa kamba. Hii nashindwa.
Okay. All right, Daktari. So again, we'll get to what he's saying in terms of like the different treatment options, right? But then again, for now, are there people who are more at risk of developing arthritis as compared to the others?
Yes, we know that arthritis is more common in women than men. Again, it is not clear whether that is because women seek medical attention earlier than men. The next thing is we say these people who are obese, those ones are at risk of getting arthritis, and more importantly, age and injury. Injury is the one that I have to emphasize, that you get osteoarthritis at a young age if you've had a major injury into a joint.
Yeah, is that the reason why we also see a case of osteoarthritis in children?
Not quite, because it's not common to see osteoarthritis in children. One of the things that can happen in children is septic arthritis, the other type I mentioned, where it tends to occur in young patients, like below the age of 5 or even below the age of 10. So the destruction of the lining of the joint now results in osteoarthritis, but that is predisposed by the fact that there was infection. Kids will present with a knee or a hip joint that is very painful and swollen. They are reluctant to move. Those are the ones who, if you do not get that diagnosis right at that time, then eventually what happens is that the joint is destroyed. That's why they need to seek medical attention, and it's an emergency.
Right. Do the symptoms appear more or less the same in adults?
No, in adults, it's a gradual process. It's described to you that in 1970s, when he started noticing gradual deformity in the knees, it comes in, first of all, is pain and swelling. The swelling is due to increased production of fluid due to inflammation inside the joint. So they get what we call, in medical terms, effusion, but it's fluid. Then pain is a key thing, and then eventually deformity. He's mentioned about the various methods of treatment. I think the one he was trying to describe to you is one option in severe cases like him. I've just met him today, is fusing the joint. Okay. Yeah, so you get the joint, the legs in a straight position, and you fuse the joint so that that joint will never move again. That's what he's saying, that he's scared of if that happens, how will he stand? And I can see his concerns. These things have moved on now. That's what used to be done in the 70s and 80s. Now we put a joint. We replace the joint so that he's able to get up and walk and sit in a position like he is.
Mzee Eliud, unaweza tuambia mguu unasikia aje, uvimbe?
Ushungu ndio unaleta tabu.
Okay, unaona imefura hapa.
Sasa sababu ya kupinduka namna hii ndio ikakuwa huko. Ilikuwa namna hii. Lakini ilikuwa na nyoroka yote. Sasa kuanzia 1990 ndio ilianza sasa kuvimba. Sasa ikaendelea. Halafu nikaenda nikapewa dawa nyingine. Sasa hiyo upimbe ukakuisha. Sasa ikawachwa sasa namna hii ilivyo. Sasa ikaanja sasa kwenda nini? Kwenda kando. Sasa inaenda kando mpaka wa leo. Hata nafikiri sasa inaongezeka tu kwenda kando.
Kwenda kando. Okay. Okay, do you want to just take us through? Yes.
The reason why they get this deformity is because as the bone rubs on the other bone, it starts wearing off. That's why we call it wear and tear. So it's like bone rubbing on bone. In his case, this bone on the lower side here called the tibia, and the upper bone here is called the femur, is rubbing on the outer side more than the inner side. So therefore, the leg starts moving outwards. Okay, yeah. Whereas on the other side, it's rubbing on the inner side more than the outer side. So that's why I'm now moving on. So this deformity, we call it windswept deformity. All this comes in that group of loss of function. So first of all, they find it difficult to do their daily activities, like using the toilet, walking. So that loss of function is what now makes us think, should we continue treating with medication or should we move on now to surgery? All right. He's very categorical, and he has said that he has tried medications and is not keen to. Now, at this stage, medication doesn't work because it's deformity. At this stage, surgery is the only thing that can work.
Yeah. All right. Of course, what we got from his concern is, the aspect of fine, so surgery, and then what happens? Will I be able to bend my knees and stuff, right? So, of course, we'll talk about that after the break in terms of diagnosis and the treatment options, because like I said, for now, for him, medication might not really work. And, of course, all that is coming up after the short break. Stay with us. All right, welcome back. Glad you're still with us. The show is Health Diary, and today it's all about osteoarthritis. Very important topic for all of us to just have a better understanding, and especially when it comes to interventions as far as osteoarthritis is concerned. Of course, to help us with the conversation, we have Dr. Michael Maru, who's a consultant trauma and orthopedic surgeon at the Nairobi Spine and Orthopedic Center, as well as Mzee Eliud Karanja, who has struggled with the same, that is arthritis, since 1970. And of course, he is here today to just share his experience with us today. So, Dr. Ari, then when it comes to the diagnosis of osteoarthritis, what is that process like?
Okay, first of all, we start with a clinical examination. So the patient comes in, like Mr. Karanja has come in here. They'll come into the clinic, so you get to know their medical background. When did it start? What was the cause at that time? Because some of them do have a definite answer, like they tell you I was hit on this knee or had an accident. Then you do examination, like in his case. So after that examination, the next best thing to do is an X-ray, just a standard radiograph, what we call an X-ray, with them standing, so that you see how the deformity appears with them. And this patient should be seen by an orthopedic surgeon. Of course, the starting point might be a medical officer because they're in the periphery, but they should be in a center where there's an orthopedic surgeon, because it's a severe deformity.
That's true, that's true. And then is the cause a factor in terms of then diagnosis and eventually treatment?
Cost is a big factor in this kind of a situation, because the kind of metal we use, I'll explain how you treat this. Yeah. When we said first line is medication and lifestyle modification. If, for example, they have arthritis with obesity, you tell them now there's arthritis, there's obesity too, lose some weight and be active. And some of them do that and the pain goes away. Then the second line is medication. We use medication like anti-inflammatories to reduce the inflammation inside the joint. And again, it can settle where there's no need to intervene more. But when it comes in at this stage, we said the only treatment that there is now surgical. Surgical, the best surgery now for arthritis is knee replacement.
So, mzee, umekuwa ukitumia dawa kwa muda gani?
Ndio mimi natumiaga dawa ya uchungu.
Hiyo uchungu ni kila siku ama ni mara moja?
Kuna wakati hapana iko uchungu sana, lakini kidogo kidogo iko saa yote. Na kuna wakati ingine inakuja kwa wingi, nasikia uchungu sana, siwezi kutembea.
Okay. And of course, Dr. He also mentioned earlier on that sometimes the medication don't work, right? What is that like?
Yeah, it's just the severity of the arthritis. We said once you get that X-ray done, then you classify, you say, is this mild, moderate, or severe arthritis? The minute we say severe arthritis, the treatment is now not medication, it's usually surgery. Of course, we bring in the other factors. One is the patient understanding of what surgery entails, and that now is the interaction between the doctor and the patient and the family, because obviously they have to make a decision whether they want surgery or not. And remember, this is not emergency. This is planned surgery. So one must give consent that they want to have surgery. But we won't tell those who have this kind of a deformity and would like to have them straightened that we do straighten them, and you put a knee replacement that allows them to walk the way they are walking, but now with the straight legs. That is doable here in our country.
All right.
Yes.
Okay. If you are on medication every single day, again, do we have like side effects of the same?
Yes, we do, and especially the anti-inflammatories. We know that some of them do result in some damage onto the stomach, lining of the stomach, and some of them can end up with having ulcers or gastritis, what we call inflammation of the lining of the stomach.
Okay. Na Mzee Eliud, so tangu 1990 umejaribu kutafuta matibabu ingine?
Kushaenda pahali mingi kwa ile hospitali za mapipa, lakini bado hawanifanyi chochote.
Okay. All right. So, Dr. again, given what he's saying, try to seek, other alternatives, but still, nothing is happening. So for his case, like you said, this is more of a severe form of arthritis, right? So what are then the treatment options for him? Is it just surgery?
Yes, listening to him carefully, I think he's been informed that that he can actually have a knee replacement. But you see, there's one thing informing a patient and a patient giving consent to go through that process. He is entitled to say he doesn't want the surgery because of one reason or another. But this kind of this level of arthritis, there isn't much else that you can offer, because eventually the knee will keep moving out. The way it's moving out this way, it stretches the ligament on that side. There is a ligament there. Eventually, he will not be able to stand because the ligament will be. So, if they don't do, if something is not done, eventually they end up on a wheelchair.
Why do you think a lot of people are not okay to go through, you know, the surgery?
First of all, especially the older patients, they still think that the surgery is done by general anesthesia. We moved from there. We now do it under regional anesthesia. We call it regional, where you're given an injection in the lower spine. It numbs from the belly button downwards. So even if they have cardiac issues, they have respiratory issues, that is usually taken care of because they are spontaneous breathing. And this takes 6 hours. So we're able to do the procedure for them in a safe way. Then the next thing is metal. You know, we still have stigma and myths about having metal in your body. That's one thing that takes to convince a patient, and that's now between the doctor and the patient. The relationship that we form, and for that patient to understand that this metal is there to help him. This metal has been tried and tested in other countries, and this can be done here. Those are the things challenges we face.
Again, when it comes to managing and just living with osteoarthritis in general, what would you say? What are some of the coping mechanisms?
Yes, I would say first of all, make the diagnosis, and it has to be the right diagnosis. Then from there, we say the causes and the predisposing factors, address them if they are. If, for example, it's gout, the gout will destroy the knee, the lining of the joint. It will become osteoarthritis. You see, the best thing is to deal with gout. So now you tell them lifestyle modification, stop drinking, stop taking red meat, all that. So that line, that's one way of dealing with it. If they're obese, they lose the weight that they need to. If they are not active, they become active. So physically active. By doing that, then you can slow down the progress of arthritis. These are for mild and moderate. But when it gets this stage, there are no other other options. It's usually to straighten the knees.
Mzee, sasa sahi kununua madawa, uko na kadi ya kwenda kupewa dawa?
Ya madawa?
Ama unatumia pesa?
Hii madawa mimi naambiago nikanunue kwa nini? Kwa kemitili.
Uko na kadi? Kadi ya NHIF?
Ya NHIF?
Hospitali. Uko nayo? Okay. All right. And of course,
hii kandi inatumiwa na familia yangu.
Kwa nini?
Lakini mimi sasa hata pahali inatakiwa pesa, hawataki kandi, wanataka pesa. Hii kwa hivyo hii kandi ya NSS kwa upande wangu hainisaidii.
Okay. All right. And of course, Dr. I will just ask the whole aspect of cost. Is it covered by NHIF or other, types of insurance, or you just have to pay cash?
Yeah, the orthopedic operations can be quite costly. And in fact, that's the reason why you find that some people say maybe you go to India because you might get it at a cheaper cost. But the reason why it's costly is because of the implants that we have to use, especially for knee or hip replacement. Like in his case, the implant that we like to use, like in his case, would be like 300,000. That's the cost of that implant. And then if you add now other charges, it can range between 400,000 to 700,000, depending on the institution you are in, due to the cost implications in those institutions, both private and public. But the good thing is what is mentioned about the NHIF card. It gives them 350,000 for a joint replacement. So they are now able to top. Some of them top up a bit, and others, depending on the institution, that can cover the core cost. So now that is variable because of being private and being public.
All right, so as we finish, and I'll take this as your parting shot, what will be then your call to action as far as just treating osteoarthritis is concerned, very quickly in like that?
I would say arthritis is a very common condition. It's a manageable condition. We know that we may not be able to to remove arthritis from your body, as some patients do ask, but it's still purely manageable. And when it's advanced, the best treatment is surgical, but always start with non-surgical. And that is something that we deal with as orthopedic surgeons here in Kenya.
All right. And of course, on that note, we just want to say thank you very much, Dr. for coming by today and, of course, helping us understand more about osteoarthritis. That has been Dr. Michael Mario, consultant trauma and orthopedic surgeon. And this is at the Nairobi Spine and Orthopedic Center. And, of course, not forgetting to say a big thank you to Eliud Karanja, who's here today to share his story as far as arthritis is concerned. And on that note, take a look at this health tip.
Let me show you some workouts for abs. Support your back by putting your arms there. Raise both legs up. Then you start by shuffling your legs this way. One, to go direct to the lower part of the ab. All right, there's another one. Hold it this way, hold your head this way. Then squeeze this leg here. 1, 2. You do 30, 40, 50, all right, to the failure. Oh, good. Another one, lie down, then on your elbows, come up, and make sure while you're there, you tighten your tummy. You can hold it there for a minute or so, 2 minutes, 1 minute, 30 seconds. Also, this one is for the abs. We call it planks.
Well, thank you very much for staying with us until the end of the show. And I hope that you've learned a lot from today's episode of Health Diary, where we were focusing on osteoarthritis. But if you still have any other question, feel free to interact with us on our social media platforms. My name is Winnie Lubembe, and special thanks to 4 Points by Sheraton for hosting us. Until next time, adios. Until next time, adios.